Hello everyone, I am Dr. Suraj Narasimhan, Consultant Interventional Cardiologist and Structural Interventional Specialist working in Narayana Health, Bengaluru. So basically, aortic stenosis, we can divide them into three stages. One is a mild aortic stenosis, the second stage is a moderate aortic stenosis, the third stage is a severe aortic stenosis. We do this grading of mild, moderate and severe based upon echocardiographic findings. These mild and moderate aortic stenosis are not dangerous. They can be managed medically, but then they should be regularly followed up to check whether this mild and moderate stenosis becomes severe in future. The treatment option which is more important is actually for the severe aortic stenosis patients. So, severe aortic stenosis is a mechanical problem. The valve is not able to open and close properly. So, this mechanical problem cannot be treated by medicines alone. The medications which we give is just for the symptomatic relief and it is a temporary measure. The permanent treatment for a patient with aortic stenosis is actually to replace the aortic valve. So, to conclude, mild and moderate aortic stenosis is just only monitor the patient and then check whether they go in for severe aortic stenosis. Once they become a severe aortic stenosis, we can wait till the time the patient becomes symptomatic. Once the patient becomes symptomatic, medications are only temporary measures and this valve has to be replaced. So, replacement of the valve is the only available option and a permanent cure for patients with severe symptomatic aortic stenosis.